Hi again, welcome back. My name is Delene Grant, and I'm now at 2018 regarding my distorted medical records at the Ministry of Health, covering up for two giant entities here in Canada, Bear Mobility and MANULIFE Insurance. This, I would call it systemic racism, okay? Please feel free again to pause and read. I'm going to try and go fast, okay? Thank you. Very interesting. I started physio in January 2018. Okay, after I got the WSIB lawyer involved and all that. Okay, and the physiotherapist Rohit Soni of Life Clinic, which is Brampton Physio and Wellness Clinic, right? He indicated that I needed a new brace and all that, and TENS machine. So all that were requested in January. Okay, please feel free to pause and read, and it will be explained in another presentation. However, when he sent it out, I wasn't sure why I got a left brace from MANULIFE. Got the left brace on February 21st, which had to be returned. Yeah. So it took another month. It took a month. It was in March 21st, before they submitted a new request. After I asked for a report, because I didn't get the brace nor the TENS machine, as you can see here. And eventually, when I asked for a copy of the report, right? Luckily, I got this one first. I got this one at the clinic, and you notice it was transposed. It's supposed to be R, right decurvatus synovitis, and left extensor, whatever this is. Okay, my left hand. Okay, so when they submitted a new request, as I said, I got a left brace instead. Left brace I got because of what they did here. So when I went to when I realized I did not get the other brace and I was fired from my job and all that, I eventually asked for a copy. I couldn't locate this copy, thank God, because not knowing that the copy that I actually got via email was different. You see the transposition here. You notice they're different, eh? So again, it was a reason to delay my recovery, delay everything. I plan with MANULIFE so that MANULIFE will not support me. That's how I got fired from my job. Yeah, you can see, right? Okay, please feel free to pause and review. Thanks. Here it is, February 21st, left. This is left brace. Okay, as you can see here. Okay, not making up stories here. It's my right hand, but they know what they're doing. Okay, then on the 7th of March, so it's a lot of other confusion, other confusion. I have right, today have right lateral whatever and right decurvatus, right? Okay. Here, Dr. Silverberg report. I saw Dr. Silverberg in November, right? He indicated there was chest pain at 90 degrees of abduction of the left shoulder and tenderness of the left lateral epicondyle, okay? And then they say the patient has post-traumatic. You see the word traumatic? When they wrote traumatic arthritis, here Dr. Silverberg said post-traumatic right wrist decurvatus synovitis. This is serious. I'm not actually laughing. Wow. However, for the 7th of March 2018, the Ministry of Health indicated other sprains and strain. You see that? Okay. And for the 21st of March, other sprains and strains, and I will show that to you. Okay, they did a new set and they still didn't get it. No, they knew, but they still tried to confuse the situation. Okay, here it is, the 21st of March. Please feel free to pause and read. It says Right, decubitus, right. See, they big mention of the breaks that I'm supposed to get. Okay, yet still Ministry of Health indicated other sprains and strains. Okay. 2019. Prior to this, started medical records from the Ministry of Health visited Great Lakes Medical Center between January and February, which I had indicated in my previous presentations. Decubitus synovitis was still confirmed 3 years later. 3 years later, 2019, I had decubitus synovitis from 2016 and have not yet received the proper care for my hand. I have not received, as indicated there. Okay, none. Great Lakes Medical, I got a test done on 24th of January, and this was the result, and it still confirmed tenosynovitis. Okay, went there for the results and still confirmed tenosynovitis. Okay, please feel free to review. Thanks. My medical records at the Ministry of Health and Long-Term Care were distorted in April 2019. That's what, yeah. Okay, those that I showed you, I just showed you over the period of time with what I have in my possession and what was at the Ministry of Health. But the medical records became distorted. I got it in April, but I guess from March, but I got it in April. I brought forward for reference the following events outline the pattern of Dr. James Chang, my family doctor of 17 years, on how I lost my job. I was being set up to be someone who had mental issues so that no one would believe my story. So sad. My doctor contributed to the loss of my job. Yeah, Dr. James Chang. And I was being set up to cover for his negligence. They make me out to be mental. Okay. Here, this is this report, and I brought it. This is from my first presentation regarding my health, right? Although this report was biased, this report actually, this was a insurance doctor, Dr. Erin Boynton, right? Who because of her report, MANULIFE ignored Dr. Silverberg's report, forced me to go to their doctor who was biased and actually say my hand was better. Where she said hand dominance, right? That's how this report came about. But this was a reason why I lost my job. But, however, she started out by saying, Miss Grant is healthy. Yeah, you can see that. See, I'm showing you again. All right. And in her report, she said I didn't have any swelling, it's hand dominance. Does this look like hand dominance to you? My hand looked deformed. It's because it's swollen. It is swollen. Okay, please feel free to pause and read. Okay. In here, Dr. James Chang, after that report, MANULIFE Insurance I have not communicated with Dr. Silverberg. They did not, this doctor, Dr. Silverberg, did the right thing, and this is a doctor with integrity. He examined me, he did everything possible and sent the report to MANULIFE. MANULIFE wouldn't have it, so that's why I was forced to see their doctor. So instead of sending the report to all the doctors, the Dr. Silverberg, Dr. James Chang and all that, they only sent the report to Dr. James Chang, myself, and the WSIB lawyer. So Dr. James Chang did not want to get involved. I went to Dr. James Chang. When I got my letter, I was able, to get an appointment at Dr. James Chang's office the following day, the 29th of March. Okay, MANULIFE wanted me back at work, so I needed the week of the 2nd. This is the 28th of March, so I needed to go to my doctor to find out. Okay. Look at what happened here. I went to my doctor on the 29th of March and see what they have here. Mental issue. Okay, you can see that. I got my first warning letter. Please feel free to read. All right, because I'm kind of going through what it says for the 3rd of April and 3rd of May, sorry. April 27th, I started getting warning letters from my company for forced back to work in my regular position. Okay, after reading that, okay, as you can see, on the 28th of April 2018, they still indicated tenosynovitis, not yet diagnosed. And then on the 3rd of May, right, because I saw my doctor immediately after. Then on the 3rd of May, they have tenosynovitis. I saw my doctor again. Okay. On the 17th of May 2018, I received another warning letter. This was the final warning letter before I got fired. And this is interesting, okay? We'll get to that in other presentations, okay? I went to my doctor on the 22nd of May, and see again, making me out to be someone mental. Yeah, this time in my doctor's office, I was shedding tears. It's wasn't bawling, as we Jamaicans would say. You know, I wasn't behaving any way out of character. I just think it's normal. Anyone about to lose their job of 20 years would cry. Maybe some people who are not normal, basically, would just maybe start going and throwing out things or cursing or whatever. No, I sat in his office and pleaded with my doctor, tears running down my eye. I said, Doc, please send a report. He refused. My doctor actually said he did not want to be involved. From March 28th, I've been going to him. March 29th, that is, I've been going to him. And I'm saying, Doc, I'm about to lose my job. This is now May 22nd. And he still said he didn't want to be involved. Can you imagine? Wow. I was pleading with him. Yeah. But now they're making me out to be mental. I guess we can't be emotional, eh? Please feel free to pause and read. Thanks. Dr. James Chang, in his report, yeah, there was a report to MANULIFE eventually. MANULIFE has been asking for the report from the 28th, okay? I will get to that. But in his report, his report had some truth to it, but some lies too, and trying to cover himself to make it seem as if he was helping me. No, he did not, right? He didn't even include the 22nd of May on it. He said, I was last seen May 3rd. You notice, I have been to his office. It says here, it shows here in the medical report. I had been to his office on May 3rd, and it says tenosynovitis. But on the 22nd, it's nowhere there at all. It's not indicated. Okay, just letting you know that the date here is incorrect. Last seen was on the 22nd of May. Okay, please feel free to review. Thanks. Defamation of my character 2022 highlights CPP report stated. Yeah, okay, I had to bring this one forward too. It says, because CPP Disability Ontario went hard on me, but their conclusion in 2022 stated, because all along I was being made out to be someone who was mental, but because of whatever went down, now they can conclude. However, Dr. Chang did not provide evidence to support any severe psychiatric symptomology, and there is no indication as to whether or not treatment was initiated. There's nothing, no treatment, because there was nothing prior to covering up for Bell Mobility or MANULIFE insurance. There was nothing to indicate that I was mental. Okay. Then it says here, if initiated, the efficacy of treatment is unknown. In the absence of any severe symptomatology and active or aggressive interventions, one cannot consider this condition disabling. Okay, here's the report. That's why I said, no evidence. Okay. I had no knowledge of what was going on until I saw this report in 2022. What did I do to these people? Yeah. I didn't understand actually what was going on. Yeah. No one must believe my story. So if I should go to court and all that, the court, especially the Ministry of Health had it that I am mental, right? The Ministry of Health, the records there said I'm mental, right? The court would not believe me where Bell is concerned and MANULIFE. Okay, moving forward. Here, the CPP report. I got fired from my job on May 24th, 2018. I'm gonna in another presentation, we give you the details of how this form was completed and why, okay? However, Dr. James Chang, on this date, I saw him on the 22nd of May, right? And Dr. James Chang, I actually saw him on the 31st of May. The 31st of May, I also saw Dr. James Chang. However, he wrote, with recent onset of depression, she will, whatever this word is, need antidepressants and psychiatric consult. Can you imagine my doctor writing that, huh? Dr. James Chang. Okay. Please feel free to pause and read. I was fired from my job. You notice I put this for a reason. The 24th of May 2018, just as proof, okay? We get back to this. I will get to this section in another presentation, okay? This is proof that since the 28th of March, as you can see, I had showed you the letter, 28th of March 2018, MANULIFE Insurance has requested a report, okay, from Dr. James Chang. It said, as stated in our letter of March 28, 2018, results of the assessment you underwent on February 21st, 2018 with Dr. Erin Boynton, right? She said, and letting me know that a report was not yet received from my family doctor. A copy of the report was sent to my doctor, and the physician, it says, a communication with your physician sent on March 28 is in addition. We did not receive an update from you regarding this matter, right? My doctor is supposed to write the report, and this is May 25th. So when I visited my doctor's office on May 31st, right, that's when my doctor is going to tell me that he did send a report to MANULIFE Insurance on regarding my situation. So I'm thinking, so how did I get fired? When I checked, when he gave me a report, I looked to the date, May 25th, and I got fired on May 24th. I've been going to my doctor since March 29th, and each time I went, my doctor said he didn't want to be involved. MANULIFE's supposed to be talking to Dr. Silverberg and all that. However, a day after I got fired, to cover himself, he wrote the report. Okay, as you can see, this is a report. This is a reply to your letter, which was March 28, 2018, regarding the link grant. Please feel free to pause and read. A lot of things here is half and half truth, half truth, half lies. Okay, please feel free to pause and read. Thanks. Please feel free to pause and read. Yeah, this is a letter that is sent over. There's nothing mentioned here about mental. Okay, just letting you know. Okay, thank you. Okay, not everything. Dr. James Chang was just trying to cover himself. Some things are correct, some things aren't. Okay. Here it says, this was a 3-page report sent by Dr. James Chang to MANULIFE Insurance one day after I was fired from my job. Although the report was misconstrued by Dr. James Chang to sway him from the blame of not providing necessary care for my injury, some information were correct. If you should read through the report, there is no mention of mental illness. Also, there are no mention of mental illnesses in previous reports from Dr. James Chang. I believe that this report and other damaging evidences confirm that Dr. James Chang was negligent, which delayed the recovery of my injury that contributed to the loss of my job. Therefore, made agreement with the system to state that I have mental issues. See my health records, as which you have already done. Okay? And then Dr. James Chang kept saying he did not know much about my injury. And that's what he kept saying all along since 2016 into 2018. He sent me to the rheumatologist, right? Then Dr. James Chang is going to say in this report here that I really don't think I have the expertise, right, to comment further on this situation at this time. I feel, you cannot use feeling where my situation is concerned. I feel that she is able to work at some job that does not require excessive use of the right hand and risk. Does he know that I have sleepless nights in pain at times? Huh? I said, since MANULIFE Insurance became involved, Dr. James Chang's actions were questionable. Between May 2017 and May 2018, Dr. James Chang insisted that he did not know much about my injury. Therefore, the reason why I was referred to a specialist, he actually refused to assist me, his patient, for almost 20 years. How convenient it was that Dr. James Chang stated in the report that he does not have the expertise to comment, but still gave his opinion. I feel she's able to work. Anyway, thank you for your time, and see you in my other presentation. Please bear with me. Thank you. Thank you.